Well, the origins of hand washing started way back in Europe when Dr. Semmelweis, in the early 1800s, discovered that hand washing can save lives. And how that worked was the babies in the nurseries were getting a lot of infections. And he observed and noted that the physicians would go to the basement and do their autopsies first, and then go up to the nursery to make rounds. And they didn't use gloves and didn't wash their hands. They would just bring the contamination up to the nurseries. He figured that out. Unfortunately, the data is saying that physicians aren't doing quite as good a job as they should washing their hands. The ancillary providers are doing a much better job, almost 2-to-1 better than physicians are with hand washing. So they've done studies to try to encourage hand washing. They put signs, they do reminders, they put it on the internet. And so I think it's getting better, but it's nowhere near what it should be yet. Nurses, about 2/3 have good hand washing technique. Physicians still aren't much over 50% with good hand washing technique. Nurses were the first to kind of rattle our cage that we're having to wash our hands all the time. How come the physicians aren't washing their hands all the time? And we're always constantly trying to get better at that. And just last week, a patient asked me if I washed my hands before I talked to her and examined her. So the patients are coming to understand, especially since the MRSA issue that's so important in our healthcare. They know to wash hands. They want us to wash hands. I think that we need to all concentrate and remember to wash our hands. It sounds so simple, but if we just wash our hands before we see the patient and wash our hands after we see the patient, it's a done deal. And hopefully, with this little quick reminder, we can do a better job.